Story at 9, a group of private medical practitioners are marching and staging a protest outside the offices of the Discovery Health and Centre in Johannesburg. The medical practitioners accuse some medical aid schemes of racial profiling and discriminating against blacks and Indian doctors, and as well as other specialists. It has been an ongoing spat for some weeks now, with the medical aid schemes denying the claims of racial profiling. The Council for Medical Schemes has launched an investigation. Let's get more now on the story. Our reporter Gillian Pillay is on the scene for us. Gillian, what's the latest?
Very good morning to you, Blaine. We are seeing quite a few practitioners, healthcare workers, clinical psychologists, doctors trickling in into the George Lee Park here, which is not far from Discovery, Blaine. Yes, it's been an ongoing spat, but in the conversations that we've had with practitioners here, it appears that this has been going on for quite a few years and that they're not really getting any satisfaction from those medical aid schemes, which they have implicated, Blaine, in what they call racial profiling, blacklisting, withholding of monies due to them, but also these lists that we hear being circulated and these alleged unfair audits being done on some of the practitioners here. As you can see, they are getting ready, Blaine, to start the march. The march is expected to converge from the George Lee Park at 10 o'clock. And it's about a 2-kilometer walk to Discovery. There they plan to hand over a memorandum of grievances. Like all memorandum of grievances, I'm sure that Discovery will have a few days to reply to some of the demands or grievances that they've put up there in the document. I'm joined here by some of the practitioners that will be participating in the march. I'm joined by Ponke Ramasolo, a clinical psychologist. She tells us that she has been audited several times. She's been in private practice since 2010. Why are you part of this particular march?
Sisters, if I can tell you what I've been through, you wouldn't want to know my story. I've stepped into that deep pit, the black tip that my patients present with when they come to see me, which is depression. There was a point where I would even take a taxi to my workplace because Discovery withheld my money. They didn't want to pay me because I refused to supply them with my clinical notes and my, patient's records. So until I handed that over to them, that's when they released my money. But then I had to sign an IOD acknowledgement of that. They said I owed them because they said, a stupid thing. They said to me my clinical notes were too brief. That's why it means I'm overcharging. So I owe them 100 and something thousand. I'm still paying that back every month. They debit 5,000 from my account. So my sister, there were times when I would hide my car. I would take a taxi to work, a whole professional taking a taxi to work. Imagine that, my sister. It hasn't been, and once they identify you, that's what I picked up. Once they identify you, you become a lifetime victim. They will go on and on with the audits. Even the previous years when they audited me, they said I owe them. And when it was time to pay off my debt, the debt that I said I owe them, they came back to re-audit me. So I'm continuing. It doesn't end. You pay them forever.
Just to find out, what are you wanting? What change would you like to see about as an affected practitioner?
From what I picked up, it's like if your practice is growing, it means as a black practitioner, you are fraudulent. There's something that you're not doing right. So black people are not meant to prosper. We are born to suffer. Well, I'm saying to Discovery, we are born to conquer. We are not going to back off until we get our demands heard. That's it.
I'm also joined by a dentist here, Blaine, who's been in the practice for more than a decade. Doctor, just give us a sense of why is it important that you join these other practitioners? I know there are similar stories here of blacklisting, of struggle. What is yours?
Before I tell my story, I would like to observe a moment of silence with my colleague for all the patients, the doctors who've committed suicide because of harassment by Discovery. We'll ask just 1 second, a moment of silence to observe in memory of our colleagues. Yes, my story is similar to what they have said. Colleagues who have committed suicide, some are depressed. It starts with entrapment. It's either they send spy cameras to your practice or they start their audits. From there, it goes to coercion. They force you to their offices where they will bring the cameras, the videos that they've recorded from your practice, and they will force you to sign an AOD. With an AOD, for that one patient, they will ask you to pay for all the patients. If you've been in practice for 10 years, they will say it means you've done that for the past 10 years. So you'll have to pay about some practitioners pays over $1 million and all that. From that, it goes to extortion. They take about $1 million or something from you, and they keep on auditing you until you really cannot cope. Then they send patients letters not to consult at your practice. That compromises your business. So a lot of practitioners end up closing their big businesses, being out of business. Then they end up committing suicide. Some are depressed, and it goes on like that.
Your stand today, when you walk for these next 2Ks, what are you saying to Discovery and to other medical aids that have been perpetuating this?
We are saying to them, first, the Council for Medical Aid Schemes must regulate these guys. They must stop all this bullying. They must stop racism. They must stop harassing our practitioners. They must stop the racial profiling. You know, they only do this to us black practitioners. So we are saying to CMS, regulate these guys. It must stop today. All these investigations are illegal. They have to stop today. All practitioners who were forced to pay back the money, those monies must be refunded. And very important, all the monies that are blocked, there's a lot of practitioners which are not paid by Discovery. Those monies must be released. The letters that were sent to patients to say do not see these practitioners, they must be stopped. So we're saying from today, stop all the bullying.
The commission of inquiry that was launched or the probe that was started some 2 weeks ago by the medical aid schemes, do you think that will bring about change, and what kind of change, if any, or are you hopeful in that process?
Our group Solutionists was started because CMS has been failing to regulate these guys. We've relied on CMS for years to stop this bullying. They've been slow. So much of the investigation has started. We'll participate, we welcome the investigation, but we're saying, much as the investigation is going on, this thing have to stop today. We're saying from today, they have to stop it until the results of the investigations are out.
And Med Scheme, we're coming for you next week.
Blaine, those are some of the sentiments from some of the participants and practitioners here, which will be partaking in that walk from 10:30 onwards. They'll be converging here from 10 o'clock, and a memorandum of grievances will be handed over to Discovery.
Yep.
As you heard, they're also targeting other medical aids, and they've got quite a few legitimate claims here that they've made around what they've been enduring for the past few years, Blaine.
All right, Gillian Pillay, thank you very much indeed for your reporting, my friend. We'll try to catch up with you a little later on to get an update with regards to this march. We're going to take a quick break. We'll get you more news next. Stay with us.